Hi, and welcome to my first vlog in which I'll be speaking about the differences between a skill and a capacity issue in both the back squat and overhead barbell press. According to Sweat in 2010, a skill is a function that involves specific movements of the body's muscles to perform a certain task. These movements are acquired through practice until executed automatically. A capacity is a certain limitation presented within the internal physics of the body's ability to function based on the structures that are in place. According to Crow et al. In 2019, such capacities can manifest in compensations due to limited function. The first athlete present is myself, in which I've come to know to have a capacity issue due to relatively acute grade 1 sprain of the ATFL in the right ankle. During the warm-up set before descent, the right ankle is kept in external rotation when compared to the left ankle. This is usually conclusive of having limited range in the right hip. One could note a hip shift towards the left side, suspecting a compensatory movement as to offload the injured limb. When increasing the external loads, it shows that the force production to overcome the external load is not an issue. However, compensatory mechanisms start to take place. From the lateral view, it shows that I'm able to keep the thighs parallel to the ground without any shifting. Looking at the back view, during the descent phase, there was a visible lean towards the left side as to offload the right limb, leading to a bar tilt and hip shift towards the left side. According to Emile et al. In 2017, there was no significant correlation between decreased ankle mobility and trunk lean. However, on the other hand, Gomez et al. 2020 did conclude that ankle mobility is associated to back squat depth. This comes to show that if the shifting and limited ankle range will persist, it may lead to losing depth during my squat technique. To assess the capacity issue, I performed an overhead squat on force plates to assess both the technical model and limb surface asymmetry. This resulted in a significant higher percentage of concentric and eccentric peak forces towards the left side. As seen, I was still able to perform the ideal technical model for a squat technique. I also performed the isometric mid-thigh pull, which showed significant results, meaning I was able to generate relatively equal amount of maximal forces over a period of time within all 3 repetitions. However, during all 3 repetitions, a shift towards the left limb was noted. Moreover, the average asymmetry force production over the 200 millisecond mark showed the ability of decreasing the shift. This comes to show that lack of confidence to load the right limb is significantly evident during the explosive phase, which improves during the isometric force production phase. According to Hodge et al. In 2011, an asymmetry of more than 1.5 cm in ankle dorsiflexion might determine a current or previous lower extremity injury. During this test, a discrepancy of more than 1.5 cm can be seen. Other measures taken to assess any muscle imbalances present within the hip, ankle, and knee joint were isometric testing, looking at max force and asymmetry. It's clearly evident that no significant asymmetry in hip and knee joint was present. However, a higher force reading was noted for the ankle joint. A certain degree of impairment is present after an ankle injury. Therefore, decided to perform high step forward and back swings to improve the mobility within the tibio-calcaneal joint. In conjunction to this, a passive stretch is also performed towards the Achilles tendon as to reduce the risk of tendon stiffness due to the swelling present around the ankle joint. I also worked on weighted single sit to stance to improve the level of confidence on the right ankle, focusing on the eccentric phase of movement. This overview comes to show that an increase in compensatory movements and lack of capacities to perform the skill cannot be present to further perform at an optimal level. The following is a young amateur footballer who has rarely performed a squat throughout his sporting career. As you can see, there are several factors this one could notice. Primarily, the athlete's head position and gaze is directed downward, leading to improper spine positions. Moreover, he is also raising his heels while descending with a forward trunk lean present. On the other hand, he is able to pass his knees over the front of the foot. However, this cannot be judged upon since the top of the thighs are not parallel to the ground. Due to the early introduction of the bar during the back squat, which might be the cause of both the forward lean and the heel raise, I started by looking at the overhead squat. My initial cues towards this athlete was to change his head position and gaze, which immediately altered the athlete's kinetics and kinematics. With the removal of an external load, the athlete was able to keep his chest up higher, which in turn showed an immediate change in foot to floor ground reaction and the ability to squat deeper. According to the scores noted during the ankle dorsiflexion range of motion testing, no significant limitations were noted. According to Kim et al. In 2015, one way to assess the lumbopelvic area, mainly the hip flexors, which comprise of iliacus, psoas major, rectus femoris, and tensor fasciae lata, I decided to use the modified Thomas test, which showed no evident mobility limitations within the athlete. Therefore, the forward limb present during the squat movement is purely due to the lack of practicing the skill rather than a capacity issue. In order to improve the overall squat skill and technique, I decided to start with simple assisted box squats, mainly to improve the motor learning system as to perform the movement unconsciously. Furthermore, I attempted to shift the weight anteriorly and cueing the athlete to perform a forward gaze whilst performing goblet squats to further encourage the athlete to keep an upright torso. This will automatically lead the athlete to maintain an upright torso, as it will reduce the shearing forces over the lumbar vertebrae with an external load present. Since there are no ankle mobility issues, the athlete performed box squats with the front foot elevated to emphasize on the fact that the ground reaction force generated during the ascent phase is passing through the heels. A drastic improvement can be seen within the athlete with minimal movement modifications and precise cues. Evidently, there are still certain factors to be worked upon. However, this comes to show that there is great potential for better movement development. This comes to show that due to lack of knowledge performing such movement, this athlete falls under the skill issue category. The following is a professional water polo athlete who is limited by capacity whilst performing the overhead barbell press. The limited capacity does not allow the athlete to fully extend the right elbow, with also compensatory rib flaring during the bar lift. The trajectory movement of the barbell is in a vertical with a posterior rotational motion, past the seat vertebral landmark rather than an upward vertical press. This comes to show the decreased contraction of the serratus anterior and middle traps, lacking stability within the scapula and decreased range of motion in the humeral joint. In conjunction to this, there is excessive lumbar and thoracic lordosis, which is limiting the athlete to properly activate the musculature associated with the pressing movement. The end position of the athlete is having the barbell far behind his head, which could be conclusive of decreased scapular humeral stability. On assessing, I came to note a deficit in the range of external rotation for the right shoulder when compared to the left side. Also, another noticeable defect was a change in strength measures. This lack of range and weakness leads to a decreased contact surface of upper body, with the barbell limiting the amount of force produced to perform the press without compensatory movements. According to Colbert 2014, these limited capacities could further increase the possibility of having a shoulder impingement syndrome in water polo players. I started off with controlled unilateral press using an inverted kettlebell as to improve the scapular stability, which is needed during the throwing deceleration phase of the upper limb. Also, external rotation range of motion drills are vital to reduce the risk of throwing related injuries. Wall slides are used to improve both range and control over rotation movement without compensating with his thoracic. After some cues and drills performed, it clearly shows the immediate improvement present within the athlete. This comes to show that with knowledge and understanding of the skill, the athlete is able to alter such weight room movement. Therefore, it's of utmost importance to acquire both the skill and capacities to perform the most efficient movement. Being a professional water polo player, it's essential to tackle such limited capacities to prevent injury and enhance performance. The next athlete is another young water polo player who presented with a skill issue when performing the overhead barbell press. A visible kyphotic posture is seen before pressing the barbell, which is indicative of the barbell resting across the middle of the fingers rather than evenly distributed across the palms and shoulders, leading to decreased overhead force. During the initiation phase of the press, athlete's barbell grip is not consistent comparing left with right, causing two different angles in which the elbows are kept. During the ascending phase, the athlete does not fully extend the elbows to balance the barbell above the head due to lack of spine stability by bracing the trunk using the deep abdominal muscles. I went straight through assessing his shoulder range of motion to rule out any deficits. However, no visible limitations were present. Testing showed no capacity limitations in both the range of motion and no significant isometric muscle strength differences were present. We start to work on bilateral shoulder control by performing bilateral wall slides. This will improve the athlete's perception of movement and also contraction of the upper traps and serratus anterior. Apart from this, it's optimal for the athlete to understand the movement required during the overhead barbell press. That is, alignment of both arms together, extended elbows, and slight orthodox posture. I further progress the athlete to use a lighter barbell and performing the overhead barbell press in a seated position, as it will allow the athlete to control the press better due to the reduction of recruitment of other muscles, mainly the legs, which are needed for stabilization. Ultimately, whilst reassessing the weight room movement, a shift could still be noted. However, the overall movement improved with minimal cues and corrections. To summarize, first athlete presented with a back squat capacity issue with limited ankle dorsiflexion, limb asymmetric ground forces, and hip shift. Improvement in ankle mobility and limiting hip shift with force analysis can take place. Athlete 2 showed poor knowledge on the movement and poor motor control, important to work on cueing and movement breakdown to further understand movement. Athlete 3 having capacity issue in the overhead barbell press due to lack of range and strength measures. Coaching would include exercises to improve shoulder mobility and the specific external rotation strength. Finally, the fourth athlete showed skill issue due to poor core contraction and poor technical model. Coaching would emphasize on corrective cues and movement breakdown.